Hi, my name is Bethany Kurth, and I'm working with Brianna Burns. We are College of St. Scholastica DNP students. The last couple months, we've been working with the gastroenterology department at St. Luke's Hospital on our DNP project that is working at improving colonoscopy completion rates. So the problem is that there's a high rate of colonoscopies, of incomplete colonoscopies at St. Luke's, partly due to poor preparation. The completion rates are one of the healthcare organization's quality measures, so incompletion rates affect their reimbursement and quality scores. And another problem is just the lack of education to healthcare staff on colonoscopy preparation. So the aim is to improve colonoscopy rates at St. Luke's from 69.8%, which is where they're currently at, to 80% by September 2024. By improving nursing education and furthering their comprehensive colonoscopy knowledge. The outcome is that hopefully they'll have improved overall colonoscopy screening percentages, patient outcomes and satisfaction, quality measures, and decreased costs to the patient and healthcare facility. So research was performed by our PICO question. In a hospital with high rates of incomplete colonoscopies, how does increased nursing education in comparison to not implementing further nursing education improve colonoscopy completion rates by September 2024? Several themes were found, including improving colonoscopy completion rates in the inpatient setting, along with specialized education to staff, patients, or both on proper colonoscopy preparation. And then with the synthesis of literature, it did find that healthcare staff education has an influential impact on colonoscopy rates. A study done by Liu et al. Found that by increasing nursing education, particularly, colonoscopies increased their completion rate from 69.3% to 86%. Another study done by Shah Khan et al. Found that increased healthcare staff education overall had a yielded decrease in poor prep percentages from 19% to 4% in a 3-month period. Healthcare staff education was especially beneficial in the inpatient setting where they have an influential role and more control over the patient situation versus the outpatient setting. And then it not only increased colonoscopy completion rates, but also increased patient satisfaction and reduced healthcare costs.
Our quality improvement project is implementing an e-learning module that will be mandatory for all inpatient nurses at St. Luke's to complete by July 3rd, 2024. They will then be required to take a 10-question post-test to assess their knowledge and learning and a 1-question survey on whether they found the module to be beneficial and helpful to their everyday practice. The percentage of nurses' participation in completing the module will serve as our outcome measure for the project. The percentage of nurses who score an 80% or better, which will be a requirement in order to complete and pass the module and test on the post-test, will be our process measure, and our balancing measure will be the survey answers, how many yeses versus nos were received from the nurses. The education department will be collecting all of the previously mentioned data electronically and send it to us as the researchers for analysis. Finally, we will relay our findings back to the gastroenterology department at St. Luke's, who will then decide whether they would like to keep the module in place for annual required education purposes for the nurses or not. The implementation process of this project has already begun. We have compiled the learning module's content and sent it to the gastroenterology department for review. Once they have made any desired changes, they will send it to the education department for creation and development of the e-learning module on Performance Manager, which is the organization's platform that is used for staff to complete their required learning modules currently. The current go live date that the e-learning module, post-test, and survey question will be active and ready for the nurses to complete is April 22nd, 2024. As previously mentioned, they will then have until July 3rd to complete the module and post-test. There will be automated reminder emails generated by Performance Manager that will be sent to the remaining staff who have yet to complete the module, as well as their unit managers. After the completion deadline and the education department has collected all the required data, the analysis of the data will then begin.